Okay, so first of all, thank you very much for coming today. We have a conference on psychological trauma. It's a very important topic to address, important from different angles and perspectives, important for all age groups, important for all cultures and all minors and ethnic groups. And we're going to have a conference online and offline, as you already know. We represent here a Student Association for Ukraine, so we are recognized at UZI from November last year. And our main aim is to raise awareness about the military conflict on the territory of Ukraine, and also to help the best way possible to the most vulnerable population in Ukraine. So who this population is? Mostly this population are disadvantaged people and of course minors. So those who are not yet developed their psyche, their all cognitive abilities and their brain functioning till the capacity that they can, adaptively understand what's going on. So it's important to take care of the vulnerable population, and that's what we're trying to do our best in the channels that are available for us. So I'm happy to host today international experts who are psychologists, psychotherapists, and also psychiatrists, and who are going to talk about what psychological trauma actually is, what are the epigenetic factors, how do psychological trauma manifest, and what are the best ways to coping with the trauma. Coping in a short term and also coping in the long term. It's my great pleasure to invite as a moderator Piera Serra. She received a master's degree in psychology from University of Padua and also a PhD in anthropology from the Bristol University. She also wrote numerous books and studies in the field of domestic violence. And currently she works as a psychotherapist in different domains in schools and also belongs to the team of the supervisors for psychologists and psychotherapists in Lugano. So it's my great pleasure to see you here and to host you here. I would invite you to come closer to me and start the presentation. Okay. Thank you.
Thank you, Aline. Thank you all of you again for being here. When the Association of Students for Ukraine asked me to be part of this conference as a chairperson, I accepted I was very, very glad to accept. First of all, it's important and significant to see young people who suffer for their war-torn country react with resilience by creating initiatives aimed at relieving the suffering of their compatriots. Secondly, it's not so frequent that help for professionals to discuss their own techniques comes from students. We are used to the opposite. We are used to be as professionals who be the ones who transmit knowledge to students. So this conference will be innovative for this respect. And I hope others will follow like that. So the program of today's conference is very intense. There will be presentations dealing with how traumas corrupt and create issues at different levels, not only in our brain, but also in our body and in our relationships with the ones we love. now not to lose our other time and to leave time for any questions after the presentation. I give immediately the floor to the first presenter, who is Sergei Tukayev. Sergei Tukayev is a scientific researcher in University of Italian Switzerland. He in the Faculty of Communication, Culture and Society, Institute of Public Health. He was senior researcher at National Taras Shevchenko University of Kiev, Educational and Scientific Center, Institute of Biology, Department of Physiology, of Brain and Psychophysiology. His presentation will be on the way of exhaustion, stress-related changes in brain activity.
No.
Really appreciate to present my study. I highly appreciate to study in special audience because very important for Ukraine, very important for young people, because we are talking about the problem of everyday stress, and especially this focus on the young audience. My study was just not finished, just made on the young in the use in the Ukrainian student audience. What's loudly? Okay. I prefer to walk and talk. Okay, I will start from the beginning. Yeah, I highly appreciate to present my study here, especially in the Ukrainian audience, especially because I will talk about the problem of Ukrainian youth and its focus on the future of young people. Because I will talk about the problem of everyday stress and how everyday stress change our brain and change only not our brain, change our mind, and the most important, not only understand the mechanism, but also maybe final point, not only understand, but also to find resolution of this problem, to propose different ways to resolve the problem according to the severity of the emotional burnout, of the stress-related disorder. Just it's my talk when emotion leaves our on the way to exhaustion. Why? When emotion leaves our? Because it's final point of emotional exhaustion, emotional burnout. It's exclusion of the emotional from our life, our personal life, from the job, from the communication with people in family and in work and so on. It's create a lot of problems. So we now exist, just now, it's my opinion, exist three levels, not only three levels, but three dimensions of this problem. First dimension, social informational problem, is a problem in the appearance in the mass media of information, different papers about emotional burnout, how it's important. So we are all in the pressure of everyday stress. We cannot work because we are stressed. We are burnout, so we can create and just it became some kind of the popular disease. So we have the same from the 19th century. It's the same now. It's the same. It's before it. Depression. It's now the problem of emotional burnout. We are living in the time of some kind of burnout pandemic. For example, here we can see different professions, from creative, artists, sexual sphere, and political sphere too. All people suffer from emotional burnout and sometimes need to find a resolution of this problem. And if we return to the problem of Ukraine, before it, so everyday stress and negative load were the most important reasons why this happened, so why it appear emotional burnout or development of emotional burnout. It's now appear new factors as the factors of the war. We can find information about how many people suffer from PTSD, from depression, from anxiety, who are living with sleeping problems and so on and so on. It's the characteristic of the emotional burnout too, not about PTSD, but depression, symptoms, anxiety, and sleeping problem is characteristic of the emotional burnout. The problem of PTSD, I'm not sure that people who live in Ukraine, especially in the civils, suffer from it. If honest to say, it's a problem of the from war, not from the information, not from the condition of the living in the society. Next one. So next important factor, why we are suffering from emotional burnout, because we are concentrated of mass media and negativity in mass media and information. It's maybe we can maybe 70–80% of mass media information have negative aspect, show negative aspect, and we are living in the time of the negativity news. It leads to the enhancement of anxious and sad mood, increasing of our worry and worsening of the mood, and increasing of anxiety, increasing depression. Also, we can see here that leads to the increase on the level of emotional burnout, compassion fatigue, and more important, desensitization related to the media coverage of social problem. What does it mean? That desensitization, we are haven't ability to understand of the problem of other people. And if before war, we can resolve this problem very easy, just experiment with my masters, just exclude TV, exclude internet, and so that leads to the decrease of the depression feeling, and also what's important, increase of thinking characteristics. So flexibility of thinking increasing after stopping to watch TV. So less TV, less internet, and less negative aspects in the internet leads to healthy, to increase health characteristic of the people. And not now yet, we cannot exclude information. We can include because we are living in this time, in the hard time. We are living in this atmosphere overload, negative overload, overflow, and just again, so add some more to formation of emotional burnout. Next one, it's a social dimension. And next dimension, it's a psychological dimension. It's what is the problem? It's how we detect, what are measurements, tools. And traditionally, and so we use several questionnaires. It's a Maslow model of emotional burnout and worker emotional burnout model. And in both questionnaires, the central characteristic is an exhaustion. If we analyze, if we look at Maslow's model of emotional burnout, she said it's process, and what's important, it leads to it's a form of job stress and serious consequences from the emotional burnout, for society, for organization, and for family, and so on and so on. And need to stress, emotional exhaustion manifests as a feeling of emptiness emotional tension or losing one's will to carry on any tasks. Just, I need to stress, feeling of emptiness. Emotional burnout, according to the Boyka, it's psychological defense mechanism. So it's people try to cope with this everyday problem by using special techniques, special mechanism, and its mechanism is exclusion of more energetical characteristic of our life, emotions. Exclusion of emotion change our behavior, leads to deformation and just leads to misunderstanding of information too. Just, and as the slides we try and analyze, it's more important now to understand we use different questionnaires, we analyze the same construct or maybe some different. We analyze, we maybe different factors which leads to the emotional burnout, and according to the Maslach and according to the work, and finds difference. But again, the most interesting characteristic of it that we find the characteristic of nervous system, which it's maybe on one side the weak nervous system promote formation of emotional burnout. The strong nervous system creates special resources for fighting this everyday problem. Just in this case, we need to say thank you for our parents, for our nervous system. And it's psychological aspects, psychological dimension of emotional burnout. Next one. It's very subjective. When we use different measurements, exist problem, misunderstanding of the items, misunderstanding of the results, and so on and so on. It's now according to the new program of Horizon Europe from 2025. It's they're looking for non-invasive markers of stress-related disorders and mental disorders. What's mean? We need to find objective characteristic of mental disorders, stress-related disorders, and by this way we cannot redefine of mental disorders because we know mechanism, we know how. So no evolution, but yeah, I guess developing of it, involvement of different structure, and why the same symptoms we can detect in different disorders. So exist several techniques, not so many. The first one is fMRI. Why it helpful? Because it allowed to detect changes in functioning of the different deep structures, cortex, and we can find relation it to the different different disorders. In this case, using of fMRI allowed to find several interesting characteristics of emotional burnout related to the behavioral changes and structural changes, functional changes inside the brain. The first one, this study showed that emotional exertion leads to the increase of the activity in two groups of brain structures, right posterior cingulate cortex and middle frontal gyrus. And what's mean? It leads to the change human awareness, episodic memory, retrieval, and evaluation of attention. Next study. So we know that emotional burnout may characterized by emotional blindness. So it's maybe some kind of the empathy. And one study analyzed empathy-related brain activity, and what they showed that decreasing of deviation in the three structures in temporal parietal junction and inferior frontal gyrus cluster. What's mean? It's the first structure integrate several flows of information, types of information, so visual information, auditory information, some other sensory information from some other sensory systems, and so on. And inferior frontal gyrus and this cluster language processing. So we all know that we're tired, we are under stress. This is the problem to speak in the foreign languages, sometimes to speak in the native language, sometimes to understand the language. Yeah, this is why it's related to the activity of the zones, and it's showed functional changes. It's more important. Last one, long-term occupational stress associated with morphological changes. Morphological changes, regional reduction in brain tissue, brain matter in anterior frontal area. This area was important because we know that this area, especially left anterior frontal cortex, the thickness of the cortex in this area relate to the feeling of the optimism. So changes in this area lead to the decrease in optimistic view. We're not so optimistic. We are not pessimists, but we have an optimism about the future. It's a final point. Why it's important? So important, we know the first functional changes, last final morphological changes. It's so from our task, we need to detect the formation of this state in the early stages. If you detect it, so we cannot, we can, by using simple technique, simple changes in the life, to not postpone, to stop the formation, development of this one. Just limbic dysfunction, emotional problem. It's the characteristic. It's again the problem of odor perception and and the memory problem, anxiety, different types of aches, concentration, and so on. Just again, so this problem of limbic system appear under everyday stress. And yeah, we stop it. But what is the problem? The problem of fMRI, it's very expensive. We cannot use, we can propose it to use in the everyday life, in the clinic, in the private use. It especially why private, because we know that consumer electronics, EEG consumer EEG, have not just became more close in their characteristic to professional EEG. And what showed EEG, using of EEG, this problem appear in the frontal area, while the bottom, because it's control our emotions, control and function. Also, what's characteristic of by a reduction of alpha power in the eyes open conditions, it shows that emotional burnout is hyperactivity. In the right state, the characteristic of the brain is the state of the hyperactivity. Oops. Just sorry for the shifting, but not so important because I need to say that several studies showed as a weak activation of the functional connection or disconnection between different parts of the brain. Yeah, it's logical. It's logical that we can detect this connection of between different parts of the brain. We can detect it in the when fatigue is a sportsman. Just maybe disconnection between the frontal area and posterior areas. Yeah, we can detect. It's maybe characteristic, but not in the right state. And we tried to analyze in all picture what it's happened, what is characteristic of the burnout brain. And we use several techniques. We analyze local changes, and we analyze more global characteristic, network, the functioning, connection, connectivity inside the brain. And what we find, the most interesting changes in the brain activity we can detect not in the final state, but in the state of the when first sites appear. So rebuilding activation of the brain under stress pressure. So just rebuilding, just preparation, and so on. And not it in the local, not so many changes in the rest state of between format, between exhausted brain and normal brain. Just maybe in the high HAMA, which relate to the high cognitive characteristic, especially in this area. It is very important because it's related to the language. Just we now, again, just appears a problem in the speaking, understanding of verbal information. Okay, it's good. But not so right, but informative. That exhausted brain is characterized by the formation two locus of the activity, the frontal area and posterior area. What is it? The first area is maybe the memory, attitude, attention, and so on. And this plus posterior areas are related to the visual information plus association area. Just maybe in the simple walk. The rest state, not rest state. We are seeking, we are focused on maybe on some negativity, we visualization of our thoughts and as attitude to the negativity maybe characteristic. It's now speculation, but maybe it's truth. And just maybe next slides to show it what it means, negativity. This one, I talk about ability to understand emotional characteristic of information, visual information, verbal information. It's important because it's related to the empathy. We need to feel the pain of other people. We analyze the reaction of the brain of our participants in two sets. In the first set, it's maybe economical information. It's not important for majority of people, and the reaction of people to terrorist attack, other disasters. So very negative images. And what we detect, that's just only non-stressed people. The brain of this people, non-stressed, normal people, their brain easy differentiate information. So we say yes. So the brain shows differentiate. It's negative, it's natural, and it's characteristic. The resources which you use, emotional cognition characteristic, which you use for understanding of fears, used for picturized understanding of negative information. But what's happened in the people who are stressed, we analyze the same curve and we cannot find any difference. What's mean? It also next bit that amplitude of this potential characteristic of real potential higher in the people who are non-stressed and then in the people stressed people. What it means is first, their brain cannot differentiate. It's not only differentiate, but important that it's maybe building of the wall. They stay, it's my, it's your, it's not me, not for me. Just go ahead. not stay. Not talk me about your problem. It's not important for me. And especially this characteristic too, they haven't resources for analyzing of this information. They haven't resources for analyzing of emotional characteristic of visual information. Yeah, it's good. It's ways. I need to stress that this markers are used in neuromarketing too. And in the voting, we can save money in the political company. And this one, mimic facial expression. We cannot control a feed, and by analyzing of changes of mimic, we can say about our emotion, the emotion of our subject. And what we detect that stress people, domination of negative feeling, anger and fear, and sadness too, but disappearing of surprise and contempt. So empathetic feeling disappear, especially contempt. That people who are look at negative images, pictures about disasters and so on, they lost content. Just again, not important. Not my problem. Next one. It's maybe strange, but stressed people hate cheerful music. Why hate? Why we so happy? I'm sad. I'm stressed. I'm living in disaster. It's from my speaking refugees here in Austria. It's more Eastern that the feeling which dominated these people. It's the hate, not hate, maybe negative attitude to the happiness of the people which lived in this area. The first feeling, why it's happy? I'm not happy, so I'm a refugee. Why sun white? Once so warm in the street. Yeah, but again, so it's characteristic. The reaction of the people to the cheerful was absolutely different from the people who liked music, and the reaction after changes in psychological states, people show that yes, this difference is a reaction of music. Yeah, we detect. So we detect that stressed people will react, and the emotional factors and the emotional sides of our life absolutely different. It's important because it may be misunderstanding of the statistics of those people can lead to the problem. If you can understand why. Not so dangerous, but dangerous to make mistake in the communication with these people. And how to resolve this problem? It's maybe the last one. It's maybe the last parts of my dissertation. How to solve the problem? It exists several ways. Maybe strong, easy way. The use of type of stimulation, for example, we analyze consumer electronics, consumer stimulator. It's the stimulation of transcutaneous auricular valgus nerve branch, and just we analyze it. It works, not work. We try to understand why it works, and what we find, yes, we detected it took characteristic of emotional burnout, improving on this characteristic after 4 stimulation. Just for stimulation, and we analyze what's happened in the brain activity. Yes, we detect increase of the activity in the brain, and while also some characteristic here activation effect. So we can detect as the brain loaders index increase of it, and also changes in frontal asymmetry and activation layer. And it's strange. We detect the improvement what has happened by just stimulation of vagus nerve. And so by reading information from looking for the relation in the paper, and today appear this nice paper. And firstly, the mechanism of it, the transcutaneous vagus nerve stimulation modulate functional connectivity between inside nucleus accumbens, but between nucleus accumbens and putamen, caudat, and medial prefrontal cortex and the occipital cortex. Yes, it's good. So modulation of it, and it's nucleus accumbens here. Just we stimulate vagus nerve, we change activity here, and by changes of activity here, we not only modify activity here, but also we modified function connections between this area and prefrontal cortex and so on. But today appear new paper, and the appears the connection between functioning of nucleus accumbens and behavioral changes, psychological characteristics. So it's nucleus accumbens activity. It's a key structure. It's a key role in the relationship between stress and depression. So by changes of the activity of nucleus accumbens, by change of activity, by active stimulation of vagus nerve, we we change brain. So many tautology, but again, so stimulation of vagus nerve, I change activity of nucleus accumbens, deep structure, and this leads, so maybe break, not so break, maybe not good words, but so create maybe types of walls between depression and everyday stress. It's exists easy way. It's an easy type of stimulation of vagus nerve. So sometimes problematic and a lot of questions. So vagal bracing, stimulation of baroreceptors, and this way we also influence on the nucleus accumbens too. And the last important one, and so this one, physical activity, be active. And this activation, if you analyze the profile, maybe pattern, psychological characteristic of people who are active or lazy, who prefer sedative type of life, sedative sport. And so we find we can find huge difference in the level of burnout, in the level of depression, and it's really, it is why it's maybe active people initially have high level of stress resistance or not, or can be. I'm not sure, because analyzing brain activity, we can detect the formation of this new alleles here, the increasing of the control from anterior frontal cortex. Again, if you remember in the initial essay, that the last point of emotional burnout, it's morphological changes here, which responds for optimistic view. And also these parts response for formation of attitude, attention, attitude, and optimism. So the increase in control from these parts, it's maybe why active people can control stress situation. Final point. It's I finish.
Thank you. Thank you. Thank you, Dr. Kukayev, for this interesting presentation and for all these consequences you show. You've shown us about what trauma triggers in our system feeling, the system of our feelings, and in our brain. Now, we're gonna hear a presentation by a clinician. Please. First, I think, Benedetta Lepori. She is psychologist and psychotherapist. She is part of cantonal social psychiatric organization to support Ukraine population. She was qualified in Italy as psychotherapist in 2014, and for several years she worked as psychotherapist in private practice, mainly with children and relations. She also collaborated in Italy with the courts of Civitavecchia and Como in the field of legal psychologist as an expert graphology. Now she will talk about quantitative and qualitative summary of support, training, monitoring, coordination, and prevention interventions in the Ukrainian population forced to flee from war. Give the rules. Can you hear Benedetta? Yeah, good.
Okay. Yes, I'm here. Giacomo, can you try to the slide, please?
Mhm.
Okay, thank you.
Good evening, everyone.
Okay, fine. Thank you. Yes, we talk about the task force that is a psychological support, is a project for the Ukrainian population. Okay. Giacomo? Sorry.
Io ci sono. Ho condiviso lo schermo.
Sì, ma potresti andare avanti tu con
Certo.
la slide? Ok, grazie.
Vai.
Yes, thank you. Okay, the task force is formed at the end of the March 2022 under the mandate of the DSS. The DSS is the Canton's Department of Health and Social Welfare, is responsible for health promotion and protection, evaluation and monitoring in the field of population health, and provide health services to the population through the OSCE. OSCE is a cantonal social psychiatric organization. It's the state agency in the canton of Ticino that incorporates all public inpatient and outpatient facilities prepared to take care of the psychiatric user. The task force consists of Maria Chiara Ferrazzo, task force leader, Stefano Barbero, Sottoceneri adult coordinator, Fabian Bazzana, Sopraceneri adult coordinator, Sara Nutzel, Sottoceneri SMP coordinator. SMP is a psychological medical service for minors. Livio Timbal, Sopraceneri SMP coordinator, Benedetta Repori, adjunct resource, e Giacomo Ielmini, adjunct resource. The purpose is to intervene in a support of the Ukrainian population migrated to the territory of Ticino with monitoring, coordination, prevention, training, and psychological support activities. In both Sopraceneri and Sottoceneri Regional Welcome Center have been established for a Ukrainian population. This center managed by the civil defense, accommodated the migrant population on a first arrival in the territory, while waiting for the assignment on apartment. Usually, people are stationed in the center for about a month. Initially, several centers were opened in the territory. Currently, there are two, one in Aurigeno for Sopraceneri and one in Lugano for Sottoceneri. Until August 2022, there was a physical presence of OSCE staff at the center on a weekly and fortnightly basis, but they became a weekly telephone presence and still is a weekly telephone presence. The intervention carried out by the task force were several and evolved over time. For the beginning, informational materials regarding OSCE services were distributed both at the CR and in schools. In addition, group activities were conducted for psychoeducational purpose with the parents of symptomatic children and adolescents, and for monitoring and support purposes with adults who presented signs of distress attributable to maladaptive syndrome, symptomatology, PTSD, anxiety disorder, and mood disorder. This slide presented shows some data of the intervention carried out, including the number of the resettled at the center and the intervention provided by the task force. As mentioned earlier, the intervention carried out by the task force have involved. One of the biggest changes has been the evolution of the intervention given to group to become individual intervention. Monitoring at the first in a presence of practitioners has become telephonic. In addition, two training interventions were given to the center operator. In the first half of 2023, the purpose was to provide tools for recognizing any early sign of crisis by refugees persons in order to prevent greater distress and to be able to pertinently report the situation to the service. The training for practitioners covered the following topics: the concept of migration trauma, the identification of alarm bells about the psychological distress of refugees, notion regarding transcultural and ethno-psychological aspects, a decalogue regarding the role of the operator in contact with the migrant population. The following slide to summarize what has been the evolution at the center: establishment of the task force, group intervention, individual intervention, weekly monitoring first in a person, then by phone, and training. The S-Desk for integration are a reference in the territory for Ukrainian living in an apartment. Currently, about 2,500, and the S-Desk are also in constant contact with the members of the task force. There is also the monitoring and benefits desk in aid of Ukrainian people in apartments, which in charge of providing subsidies at and then the monitoring and the benefits desk offers the Ukrainian population the figure of the job coach who guides in the area of employment. The task force in the first half of the 2023 also offered training to the operator of the two services. In the table present, here you can see the number of patients of OSC in the period.
The cantonal social psychiatric organization consists of several services in which applicants for psychiatric or psychological support are taken care of. These include the psychosocial services, which are outpatient services aimed at adults with an activity in the fields of psychiatry and psychology. The SPSS are based in Chiasso, Lugano, Locarno, Bellinzona, and a sub-office in Biasca, as you can see from this minimap. They specialize in the activities of prevention, diagnosis, treatment, and rehabilitation of adult and elderly mental disorder. The type of intake of the SPSS differs from that of a private practice in the type of intervention, usually multidisciplinary, that is, with the participation of various professional figures, nurse, social worker, psychologists, psychotherapists, and psychiatrists. People go to these services to benefit from specific intake. Regarding Ukrainian people, usually the reason for consultation is for one of the following disorders. Post-traumatic stress disorder, for example, it is present as a delayed and protracted response to a stressful event or situation of short or long duration, of an exceptionally threatening or catastrophic nature, capable of causing severe malaise in those people. Maladjustment disorder, which is a condition of subjective malaise and emotional disturbance, usually interfering with social functioning and performance, and arising in the period of adjustment to a significant life change or stressful event. Mood disorders, which may be mild, medium severe, or severe episodes, the patient presents with lower mood, reduced energy, and decreased activity. The ability to feel pleasure, interest, and concentration are impaired, and marked fatigue are after even minimal exertion is common. Sleep is usually disturbed, and appetite is decreased. Self-esteem and self-confidence are almost always reduced, and even in the mild forms, ideas of guilt and worthlessness are often present. Finally, the somatoform disorders. The main feature of these disorders is the repeated occurrence of somatic symptoms, along with the continuous request for medical investigation, despite repeated negative examination and reassurance from doctors that the symptoms do not have a physical basis. In some cases, there was a history of intake in Ukraine, while in others it was necessary, following diagnosis consultation, to integrate psychological work with psychiatric work and to set up drug therapy. Regarding the type of therapeutic work carried out, in the beginning of the teams were mainly related to war and cultural uprooting. The therapeutic work was centered on accompanying and supporting integration. As the months went by, the themes that surfaced in therapy became more and more subjective and relational in nature, such as problems in the couple. It should be emphasized that when it comes to asking for help in the area of mental health, there may be a certain reluctance to expose oneself due to the feeling of shame or irrational fears related to stigma. In spite of this, and once this initial barrier of seeking contact is overcome, we are noticing that people who recognize the need continue to benefit from psychotherapeutic work with a reported improvement in quality of life. As discussed earlier, with respect to the psychosocial services, adult outpatient clinics, there are then services in Ticino that deals with the pedopsychiatric problems of children, adolescents, and their families. Medical Psychological Service, which is SMP, that Benedetta talked about before. The Medical Psychological Service specializes in child and adolescent psychiatry with objective of prevention, diagnosis, and treatment of mental affliction of children and adolescents in their family and social environment. Family or of the minor may come to it spontaneously or referred by third parties, for example, the school. After an initial diagnostic evaluation, a decision is made whether to activate individual type of therapy carried at the SMPs or group type carried at the psychoeducational centers. The medical psychological service is organized into multidisciplinary teams headed by a child and adolescent psychiatric specialist, as it is the case in the SPSS discussed before. Regarding intake, in juveniles the disorders are the same as those mentioned above, with the addition of behavioral and conduct disorder. In some cases, families requested further investigation on the school's recommendation for a suspected autism spectrum disorder. In some cases, it was noted that the children who had experienced trauma enacted emotional and cognitive freezing reaction, symptoms usually associated with an autism disorder. Remaining in the topic of minors, at the beginning of the conflict and with the arrival of the first Ukrainian people in Ticino, the task force took steps to distribute information material to school regarding territorial services with indication of where they could refer families of children showing signs of psychological distress. In some cases, teachers requested the task force support for specific complex situations that affected new Ukrainian pupils, and therefore direct psychoeducational interventions were made from time to time based on the demand brought in. These interventions had not only a clinical value, but also an integrative purpose of the Ukrainian children in the class group. To date, the task force continues to be a constant supportive presence for schools, which also takes place through telephone and email consultation with principals, teachers, and pedagogical support group leaders regarding complex situations concerning Ukrainian pupils. Last but not least, there are also interventions with older people, which is over 65 years of age. The reason for consultation is usually similar to those reported in adults, so the post-traumatic stress disorder, maladaptive syndromes, and mood disorder. Even in this age group, in some cases there are patients who already had a psychological or psychiatric follow-up in Ukraine. Causing the listed disorder is usually a reduced flexibility to change in this situation of uprooting and life mutation, as well as the presence of thoughts related to family members who did not share the same migration decision. Another project of the task force is the creation of a questionnaire on the health status of the migrant population receiving Ticino, in this case specifically for the Ukrainian people. It was designed with the following objectives: to assess the general psychological health status, to ascertain whether the people feel they have received sufficient information regarding OSCE services, and also to examine whether the received population requests help in case of psychological distress. The task force is disseminating the questionnaire to Ukrainian population through the S-Desk for the integration, the monitoring and performance desk, and the regional reception centers, and has already begun receiving the first completed questionnaires. As I said before, the data are statistically analyzed to assess the state of mental health of the Ukrainian population in our territory. A first qualitative cross-reference shows a fair state of psychological well-being. In fact, following an initial analysis of the questionnaire received, no critical issues emerged with respect to the reported state of health of the Ukrainian migrant population. From this, we can infer that in general the people in the territory of Ticino have a good state of health, a psychological health. Now we take the opportunity to do some marketing. Please let me. I would like to make you aware that questionnaires are available in the room today, and that if you want to, you can fill them out anonymously and mailing them using the envelope already addressed to our services. We would like to emphasize that the task force is still operating in support of the mental health of the Ukrainian migrant population in Ticino. Psychological well-being is the goal to which the canton aspires. We realize, nevertheless, that this concept is not static, but constantly evolving, and therefore we emphasize our availability. Of course, the basis of therapeutic work is the intrinsic motivation of the person who decides to undertake this path. Before concluding, these are our contacts. We would like to remind you that to contact the OSCE Contact Center regarding adults and directly the Medical Psychological Service for minors. On behalf of the task force, we thank you everyone very much for your attention. And I would like to thank Alina also for inviting us here today.
Thank you very much for taking part today with this wonderful presentation, also for your devotion and commitment. And if I just may ask one small question, I'm sorry for the echo. The question concerns the ethno-psychological aspects of Ukrainian population that you might have observed and noticed yourself. If you can reflect a bit on that. Thank you.
Maybe just a word about it. As I said before, in the beginning, when there was Ukrainian people who came at the service, we encountered a small difficulty to begin a psychological work, because there is still this big stigma of the psychological and the mental ill and mental disorder in general. So usually there is a first step where we try to recreate a new image of psychological work, because people can think that if they go to a psychotherapist or psychiatrist and etc., there is something that is wrong with them. But once we overcome this first step, then we see that people are much more available to speak about themselves, about the problems they encountered in their life. And as I said before in the presentation, at first, probably they will speak much more about the war and the trauma of it, but then they begin to open more about themselves and about their relationship and their families and two other problems. I hope I answer your question.
Thank you, both of you. Did you? Thank you, both of you. And the second part of this very interesting presentation was by Giacomo Giannini. He has a degree in clinical psychology from the University of Fribourg and Lausanne. She worked as a psychologist at the Bellinzona Psychosocial Service, and currently he's working as a psychologist in it's a psychosocial service in Lugano and for the Red Cross. Are there any other questions about this very interesting presentation and this important work which is going on in our country, in our region? Other questions? Maybe afterwards we'll have a debate at the end of presentations. Now I am going to present Katerina Solomianova. She also is a clinical professional. She received a master's degree in psychology from the University of Kharkiv, Ukraine. She had studied psychological service in charity foundation in Turkey, which supports kids and adolescents with adverse childhood experiences. She also has the Ukrainian Association for Contextual Behavioral Science. Now, she's going to talk about psychological assistance to kids with adverse childhood experiences within the context of war.
Thank you so much for the introduction. Do you hear me well?
Yeah, I think so.
Great. Now I try to share my presentation and start a report. Just a sec. So I need the feedback. Do you see my presentation now?
Okay, we see.
Yeah, great.
Okay,
First of all, I would like to tell you that I'm going to divide my report for two parts. According to establishing psychological health in our foundation. First, let me dive you into a context of our organization. Our foundation is committed to orphans, semi-orphans, and kids from families with low income, refugees, etc. However, since February 2022, each child in Kharkiv has faced traumatic events. That's why our doors are open for everyone. In foundation, we work mainly with the children who have insecure, disorganized attachment, adverse childhood experience as well, and high level of allostatic load. Here, I would like to mention the research of Filetti and Anda that covers more than 70,000 children. They discovered that people with 4 and more categories of adverse childhood experience have 4 to 12 times greater risks of alcohol and drugs addiction, depression, and suicide in future. Here are a few figures, and as you understand from this slide, having ACE predicts risk of obesity, diabetes, cardiovascular diseases, cancer, psychological disorders, and even sexually transmitted diseases. Obviously, kids with ACE are fertile ground to develop complex post-traumatic stress disorders, personality disorders, and PTSD associated with war. So the first stage of help targeted on accumulation of resources during group activities and overcoming serious consequences of war-related stress with single kids. I would like to tell you a few words about this stage of work. As you definitely know, trauma affects the brain. So the amygdala becomes more active. That's why during the first 6-8 months, we observed hyperreaction to loud sounds, news about missile strikes. Now we can see habituation to such stimulus and feeling of fear. However, kids still easily lose their temper when they are exposed to anger or sadness. I note as well sleep problems, but I should admit that the online education compounds it. Thus, kids don't have a strict schedule, and if parents do not monitor, as is usual for our kids, they could spend nights playing with gadgets. In our work, we use different neuropsychological exercises, training of fine motor skills, breathing, and grounding techniques to overcome mentioned consequences. Let's have a brief look. Here you can see how we work with balls, tennis balls, to proceed neuroactivity of a brain. We should do it correctly and together. Just a few more seconds to see our kids, our foundation, and our work. It's simply but quite effective technique which helps to develop new neurons in a brain. One more zone that suffers from traumatic events is the hippocampus. It's the next slide, and I wouldn't stop the player. You just watch the video, and I will tell you a few words about it. So as I mentioned, one more zone in our brain that suffers from traumatic events is the hippocampus. That causes troubles with memory, intrusions such as nightmares and flashbacks. But to be honest, flashbacks aren't very frequent. Usually, we can observe them only with other severe symptoms of PTSD, which cannot be said about memory difficulties and nightmares. It's usual thing to observe them, while other diagnostics criteria of PTSD have not been met. Apparently, memory issues influence academic achievement in a negative way. I designed special activities for our group lessons to help kids cope with memory issues as well. And now you saw a video, just a few seconds, you saw video with kids. They tried to make from a Play-Doh aliens with my instructions. So they should remember the instructions. They should remember how appear this alien, and then they should rebuild it without my words and any clues, just with the help of their memory. Trauma also affects parts of the cerebral cortex. As I said, our students have already been suffering from adverse childhood experience, and the war exacerbates it in a negative effect. Therefore, we observe problems with concentration, low impulse control, problems with interpreting emotions, solving cognitive and behavioral tasks, and difficulties with social interactions. To reduce that, we offer various group tasks, techniques from behavioral therapy, exercises for positive self-images and emotional competence. Here in this video, you can see collective tasks which did our kids along psychological training. Some of our students, as I mentioned before, received individual therapy in addition to group activities. It's protected by a privacy policy, but I can show you a few photos. From February 2022, the amount of our kids in our foundation has tripled, and it was clear that us blind sports, as long as we don't have enough resources to provide assistance to each kid in Trochy Vognu. Thus, we had find out new approaches how to help them more effectively. That's why we've started to build up the psychological service and increase the staff of mental health professionals. and it conveys fascinating results. Let me share that with you. Obviously, more kids are covered with psychological help. Now we can talk about 160 to 200 kids and families each month. Certainly, the family environment is crucial while we talk about kids, mental health, and the mental health of family parts. However, in Ukrainian, enriching of psychological help is still stigmatized. For these reasons, I've introduced some psychoeducational and low-intensive interventions events, such as parental club, short video on actual topics. Due to increasing of the staff, I'm able to conduct methodological work. As a result, we developed monthly screening program for teenagers and suicide prevention protocol. Now we are able to catch signs of life and health threatening state among kids on early stages. We monitor symptoms of such problems as suicidal risks, non-suicidal, self-harm, PTSD, affective disorder. Moreover, psychological service can provide suicide prevention interventions and safety planning rapidly. And here is the result. During the first months of the work screening program, we detected and prevented a suicidal attempt, real suicidal attempt. We incorporate art. The one more thing that we've done during this month, we incorporate art lessons with psychological interventions. Here we target those kids who don't want to have direct psychological help, afraid of psychologists, but have a good rapport with an art or music teachers. Through the art process, we build up trauma narrative, teach them breathing and grounding techniques that help stabilize during air alerts and missile strikes. There are some neurodivergent kids with developmental delay in Trojivognu. Now we've got tutors for them. Of course, there are plenty of ambitious plans. For instance, to build up a screening program for younger kids, develop and implement individual plans for remedial activities addressed to neurodivergent kids, provide DBT-inspired groups for adolescents to build up their complex strategies, establish daily psychological 5 minutes. One more challenge is to increase the quantity of students. According to our plan, by September 2024, we will have been supporting 350 kids and, of course, their families. Moreover, we dream about affiliation of our center in different parts of Kharkiv region to help kids overcome negative influence of war on their mental health and compensate for the educational losses. To make that come true, we should determine some topical tasks. Among them is building a clear system of prioritizing psychological help beneficiaries. Owing to our screening program, we are able to detect problems on early stages. We found out that 95% of our adolescents need psychological assistance of different intensity. Firstly, we need to make hierarchy of help recipients from the most urgent requests to light problems. Secondary, we should distribute kids in a proper way. Here we should consider that some of our psychologists are able to make some counseling work, but do not have enough experience to make psychotherapeutic interventions. Things become more difficult because, as I mentioned before, our kids have unreliable attachment. Children take painfully any transferring to another specialist. Thus, we have to really, we have no worries to, or we have no rights to make mistakes. We need consistently modified treatment protocols to changeable contexts in Ukraine, and it is one more sustainable issue. International experience is quite valuable. However, the war in Ukraine is full of counterintuitive experience, and it hurts much more deeply. For example, in afternoon, you can see ordinary city life with working shops and cafes, and at night, wake up from the loudest sound of the explosions. Then in the morning you hear about killed people and see again regular life. Moreover, as far as war has been going already for almost 2 years, the stress is both acute and chronic. Whereas the war keep on, we can fully work on traumatic experience. So mental health professional should be very careful making treatment plan and choosing intervention. On the one hand, we need to help kids increase resilience and reintegrate traumatic experience. On the other hand, we should take to account that psyche is already overloaded and it will be easily to re-traumatize a person. For this reason, we should take it slow and work more on accumulation of psyche resources. I hope now you dive into Ukrainian context more deeply and review the idea that our work now unique and harsh. I hope you will be able to suggest some ideas how to make our treatment protocols easily changeable and at the same time coherent. And the last but not the least is how to combine protective and recover from trauma interventions with correctional programs for neurodivergent kids. They suffer from the war influence as each of us. However, it stays overlooked in front of manifestation, for instance, symptoms of autism spectrum. Therefore, I guess there should be specific diagnostic tools and treatment approach. I would like to invite you to a discussion and suggestion how to solve pointed tasks. And of course, I would be glad to answer any question about our work. But before that, I do need to say a few words of honor to my fascinating colleagues from Trokhi Vognu, teachers of art and music, math, languages, and so on. They help kids to build self-efficacy, improve academic skills, and have reliable adults in their life. And of course, experience secure attachment. It's great contribution to psyche resilience during the war. Thank you.
Thank you so much for this very interesting report about your work, a very big work, very important work. Is there any questions for Ms. Salomonia? Any questions? No. So next presentation is still about minor persons. It's about adolescents. It will be by Margherita Luciani. Dr. Margherita Luciani received a PhD in Communication Sciences, specialization in discourse and argumentation, University of Lugano, Switzerland. She is teacher at over 5 sciences and arts over Switzerland. And psychotherapist at Museo Ascolto. Museo Ascolto is a service for psychological support provided by the Museo University. And here the title of speech is Close to Adolescence and the Pandemic. Here.
Good evening, everybody. Can you hear me?
Yeah.
Okay, thank you for this introduction. Let's set the floor. Okay, so I face a transcultural topic, namely adolescence and pandemics. So I conducted a research, which was an intervention research. I hear an echo. Do you hear echo or not?
She's hearing an echo.
No, don't worry.
Okay,
No,
okay.
don't worry. We don't see. You don't hear you.
Okay, perfect. My research was conducted with a research team composed by professors and students from the Catholic University of the Sacred Heart and from the Centro Milanese di Terapia della Famiglia, a psychotherapy, and concerned the traumatic experience of the COVID-19 pandemic in the adolescents. So now a bit about the contents of this work. I will illustrate the contextual premises, which was the goal of the project, the main goal of the project, the theoretical framework on which we relied to conduct this work, this research intervention, had both a theoretical and an applied clinical side. I will explain you what the U2 project is, namely this applied and theoretical project, the core concept of the project, which were the research hypotheses, the pilot study, the methodology of data analysis, and I will give you some hints with the preliminary results. And finally, we will go to the conclusions. So, a strong side of strong point of the work was that the research was led by a multicultural team and a very heterogeneous team in terms of gender, age, and specializations. What were the contextual premises in which we decided to carry out this intervention? So the contextual premises were, let's say, very challenging. We observed increased self-harm behaviors in adolescents, according to the state-of-the-art literature, social withdrawal, and apathy. These were all points that have been highlighted due to the COVID-19 pandemic. Then, secondly, there was a violent change of the premises on which the psychological development of adolescents is built. For example, let us think that adolescents, in order to become autonomous, need to go away from home. Instead, they had to stay all the time at home with their adults of reference. Then, thirdly, we observed a growing need to work on what is called psychological well-being in order to support young people in these disruptive events. So the overall goal of the project was to promote adolescents' well-being after the traumatic experience of the COVID-19 and to propose an intervention of support and distress prevention. So it was both an intervention of prevention and action at the same time. So we decided to act mainly on two factors. Is the empowerment of resources and competencies of which adolescents are full. They are very generative, in a very generative phase of life, and this means that they can face traumatic experiences as the pandemic was in a very generative way. And then second, we decided to act on elaboration of the pandemic experience related to their evolutive process. Namely, we were interested in looking at their emotions and thoughts and at the phases, at the points, at the moments, at the transitions in which these elaborations was stuck in their evolutive process. So the sub-goals were to promote self-redefinition in the post-pandemic context concerning the systems in which the adolescents are embedded. Then the adolescents' redefinition of the future, in the light of the valorization of the present, namely of what of beautiful was survived, and the re-elaboration of the past, that is the terrible, that was, under a constructive perspective. So let's say we decided to look at the traumatic experience almost as a gift and as an opportunity of growth. Then another sub-goals which helped us in reaching the main goal of the project was to foster group cohesion as well as group support. So we believed that fostering group cohesion and group support would have produced psychological as well as social well-being. It was very important for us to let them share experiences among peers, since if I say something to an adolescent as an adult, it has not the same resonance as if this would have been pronounced by a peer. Then we decided that we should have, it was due to give them back an active role in the changing process of their social context by giving them the possibility to have a constructive dialogue with adults. So in order to do that, we relied on a very strong theoretical framework, which is fundamental for us. And we decided to rely on the theory of the emergency psychology, first of all, because we were facing an emergence, a traumatic experience. Then we decided to rely on the systems theory, in particular on the systems theory deriving from the Milan approach. And since we believe that it was necessary to look at the adolescents, their environment, in their systems, in the systems in which they were embedded. Then we decided to rely on positive psychology and psychological well-being scale, those developed by Riff and Singer, and then we decided to do this research action, as I said at the beginning. So there was a first phase, phase 1. So the name of the project, the #U2 project. There was the phase 1, which was called Restarting from Us, in which we went physically in classes, in school, in high school schools, and conducted some workshop and some and we discussed with adolescents. And this was based on the positive psychology and complex system theory. Then there was phase 2, it was called Reborn by Creating, which consists in organizing a special event in which adolescents are the protagonist of the event and propose some creative work in order to go beyond the pandemic, beyond the trauma. And this is based, theoretically speaking, on the pedagogy of fit. So the phase 1, Restarting from Us, there were involved 12 classes, which involved 3,020 participants, aged 13 to 19. And we conducted a cycle of 3 meetings for each class. So each class had a cycle of 3 meetings. The first was based on the reflection on the past, on what had happened in the past. So on the pandemic, what happened in the pandemic, how the relations were in the pandemic, the use of the social media, and so on and so forth. Then the second meeting was focused on the present. That is, we shifted the focus on the awareness of the present moment. So on what the past pandemic traumatic experience resulted in the present, in the Ik et Nunc, in that precise moment. And then the third meeting concerned the imagination of a shared future. So how do you imagine a future which cannot be the same as it was before the pandemic, as it was before the traumatic experience, but it will be a new normality that we have to discover together. So the phase 2, Reborn by Creating, consists in this creative workshop in which adolescents are asked to create projects and products that are an expression of their needs and ideas with a view to active and innovative citizenship. So their works will be presented during a special event where the young people will have the opportunity to be heard by an audience of professionals from different sectors, university, entrepreneurs, and so on and so forth. The core concept of the project, theoretically speaking, as you can see, is the elaboration of the experience and the integration of the traumatic experience in the flow of life, from past to the present to the future. So for what concerns the complex system theory, we referred to the concept of the memory, which is necessary to evolve, to the importance of the observation and auto-narration from what concerns the past. From what concerns the present, we refer to the structural coupling and to the bidirectionality of context, and what concerns the future, to the creation of meaning, to the self-determination in relation to the context. For what concerns the six-dimensional model of psychological well-being, for what concerns the past, we reflected a lot on the importance of the self-acceptance in the context of what has happened, on the importance of autonomy, for what concerns the present, we concentrated on the importance of the positive relations with others in overcoming the traumatic experience in the Ik et Nunc, and on the environmental mastery, that is in the overcoming of the trauma by having control on the environment. Then, for what concerns the future, we concentrated on the importance of purpose in life and on the dimension of personal growth after a traumatic experience. So the research hypotheses were finding out the needs, difficulties, and resources of adolescents, knowing what are the emerging adolescents' collective narratives concerning the traumatic experience of the pandemic, understanding which shared narratives can be deployed to foster ideas of reappropriation of adolescent identities. This is based on the idea that trauma can be overcome only by sharing ideas, by sharing narratives, and by sharing premises. Then we hypothesized and increased, after all these actions, an increase in perceived psychological well-being following the interventions. For what concerns the data analysis, we adopted a mixed methodology. Indeed, we proceeded to a quantitative data with a psychological well-being scale and a positive and negative affect scale by giving ad hoc questionnaires, both pre-intervention as well as post-intervention. Then we went to qualitative data analysis, and we used in particular grounded theory. So we used the constant comparison method, identification of topics concerning the adolescent pandemic relationship, and the observation of similarities and differences in the way in which adolescents viewed and lived the traumatic experience. Then let us now go to the preliminary results. So for what concerns the first hypothesis, namely the finding out of the needs, the difficulties, and the resources of adolescents, we found out that there was a relational need to expand one's network by creating new bonds and connections. Then the importance, this is an important point in every traumatic experience. As I said before, the need for moments of confrontation with peers, okay? Not only with adults, but with peers that can understand, feel, and experience right the same as you. Then there is the need to be seen by the adult world that has to legitimize adolescents' needs and problems. So in such a traumatic experience, and in every traumatic experience, the legitimation of adults is very important. And then after a traumatic experience, the moment of crisis and of difficulty can be deployed to give the person a new sense by recognizing them as active agents of change in their context. That is, we acted on agency, on the importance of agency. For what concerns the second hypothesis, that is knowing what are the emerging adolescents' collective narratives concerning the pandemic, we discovered that activities that were typical and licit in the adolescent period became illegal, namely go out, and were identified as one of the causes of the proliferation of the virus. And this was something that hurted a lot of adolescents. Teenagers felt sidelined. Their identity was reduced to the role of students and passive spectators of the reality. Furthermore, a shared narrative has been created that sees an extraordinary and acute event like the pandemic as normal and chronic. This is something that often happens in traumatic experience that lasts long time. And creates another trauma on trauma. The extraordinary that events normal. Then there was the perception of an adult world that believes it knows what is best for them, but is unwilling to listen to their real needs by negotiating and co-constructing a shared project. For what concerns the third hypothesis, understanding which shared narratives can be deployed to foster idea of reappropriation and of adolescent identity, I have inserted some quotations of adolescents which speak alone, I believe. So we are not only students, can be workers and volunteers and share original and new ideas to improve the society of which we are the future. If we had more opportunities for exchange and confrontation with both our peer and the other world, we would be able to create value for the community. We no longer need to think about the past and what has been, but want to focus on what we can do now in the present to build our future in which we will be the protagonists. Not every problem has to be traced back to the pandemic. Some problems can be traced back to situations and contexts specific to this period of the life cycle. These two last points are very important because when one person has the traumatic experience, uh, everybody sees every problem as bound to the traumatic experience. But it is not the case because persons are much more beyond the traumatic experience. So this is something that should be always kept in mind. So now to the conclusion, the participatory approach and observation have shown to be the valid methodologies to grasp adolescents' shared narratives that enable to co-construct with them a new reality. Collective and shared narrations are fundamental tools to promote the idea of reappropriation of adolescent identities. Creating group cohesion and a community of co-living is a key asset, enabling adolescents to be active protagonists in their own life instead of being mere spectators. Future steps will take into account participants' feedback in order to redesign and modify well-established life practices in an always iterative way under a truly systemic perspectives. How important it has proved how important it is to maintain an active listening ready to accept the premises that the young people have constructed after the traumatic experience of the pandemic, which have proved to be completely different from those of the adult world, and perhaps different also from those we have as therapists. So this is the end of my presentation. I thank you for your attention.
Thank you, Dr. Sanchan, for this report. It was very interesting to see your study, which is twofold. You had an intervention towards adolescents and to limit the negative consequences of pandemic, and you also collected very, very interesting data. Thank you so much. Is there any question for Dr. Salucciani?
Yes, I have.
Okay, there is a question.
Yeah.
Can you come here?
Sure.
Thank you.
Sarah, I just want to ask you about your opinion, because I represent a woman association, Swiss association, and first when we...
I cannot hear you that so well.
Use the microphone.
Maybe you should.
Now it's better.
Better, yes.
Sorry, it was the first time when I use this device in my life. I want to ask you now, I represent a Swiss association, a woman association, and we created an initiative to help children who lose their parents. And we are not psychology person, people who don't have this education. And what we did, we found a camp in Ukraine. I want to speak about kids in Ukraine who lose their parents during the war. And we found this camp which renovate their mental health, but it just for 2 weeks. And now it costs a lot. And we think we need to change something because we spend 800 francs to send just one children for 2 weeks. And we think it's not enough. And now we want to find some method, some creative way to help more children, but with more attention for mental health. You spoke about creativity. Maybe you recommend us some project, some initiative, how to help children and spend less money and raise fundraising for this project, for this initiative. And maybe we can unite all of us to help these children.
Thank you. This is interesting.
Thank you.
You can.
Yes, I think it's very interesting. Thank you for what you said. Yes, I think the important point important points are two in this with respect to this namely the importance of peer education. That is that you can let's say deploy some children that are expert of something, of some traumatic experience, such as, for example, losing parents, and let them help other children that are not. This will help a lot. And another thing is that when you have such,
how we can organize it. For example, you saw that we can find healthy kids and they can help. And how we can organize it? We need to create some groups in Ukraine or in the world or in some universities for these classes.
yeah,
How it can be possible, and could they study something before they can start to help? Because, for example, I'm healthy kid, but I don't know how to support, how to help children who lose their parents.
I think it would be important to put together children who have elaborated for what is possible the experience, and children who have not, because children who have could implicitly help, let's say without doing anything but playing together, the other who don't have elaborated the traumatic experience. And this is one point. And the other point that I wanted to say is that of the of re-giving them an active role in their life, because they have not decided to lose their parents. So it's a traumatic experience since they couldn't decide. So they should have the opportunity to give birth to something that they decide and that then they see realized. That can be also something small.
Margherita, let me appreciate your elaborated answer. I think it's a very important and very big question. And I think we can leave this question to think after the conference is done by all the presenters. And I think that every expert who is taking part in this conference will give his or her thoughts on that issue. Because we have researchers, we have psychologists, psychotherapists, psychiatrists. So the question has to be addressed. And as you said, Zenia, we have to work in collaboration to find the most appropriate answer to this question. And I think Margherita also needs a bit of time to think to give the right answer. So my proposition is to leave this question at the very end of the conference. And now I propose the next presenter to start his presentation, and I'm giving the words to Pierre Esther. Thank you.
Thank you.
So thank you, Eugenia, thank you, Dr. Milani, and thank you, Alina, for this, Luciano, sorry, and thank you, Alina, for this interesting, enlargement of the conference. So we can have another step after, and we can go on with the work which is just big, which now we are just starting. The following presentation is by Arnold van Boeren. He is from Netherlands. He is a psychotherapist, and he is trained and a supervisor in system pest avoidance system motor psychotherapy. And he will give us a contribution about how pest avoidance system psychomotor presentation is a good tool in healing developmental and transgenerational trauma.
Okay, thank you very much. Good evening all together. Thank you for giving me the opportunity to tell you something about PBSP. Can you hear me well?
Yeah, yes, perfectly, thank you.
Okay. Well, I'm trying to share, but I see. Can somebody help me? I first have to give permission.
Sir, you can just start sharing your slides. Excuse me, can you hear me?
Yeah.
You can start sharing your slides. Do you have slides?
Yes, yes.
He has. Okay, so just could you please click on share option, which is on the top?
Yes, I did. I did.
Just click on share and it will start sharing. Are you able? Yes, just click there.
I did, but I get there are.
Okay.
It's asking for permission.
Permission? No, you don't need permission. You just click share, and there will be screen and this screen, and you
Okay.
stop. Okay, I can stop presenting. Okay, so just click on share, and there will be screen option, Windows and screen. Click on screen, and it will start presenting.
Yeah, but
can you do it?
Yes, but it says we need permission to share your screen.
Oh, okay. Could you please? I'm removing you from the meeting. Could you please enter the meeting again, if possible? Lena, click on yes as soon as you request. Okay. Yes, now please try, sir.
Can you check that? Because you can let him present too. There is an opportunity that you as the host can let him present.
Okay, but one second. Spotlight fit on the frame.
Jesus. I'm sorry, but I really cannot.
Okay.
Wait a minute. Wait a minute. I got to again try it again.
Okay. If you want, you can send us the slides and we can present it for you.
Yeah, you have the slides. I sent them to Piera.
Okay.
I found it. Yes.
Could you please send to Ukrainian something email? Which okay, let's see. This one. Yeah, I can check my email and then.
You didn't show your ability to see. Yes.
Yeah, I got it. Which one? Okay, okay, I got it. This one.
Okay.
That's it.
Done. Okay.
Okay, slideshow and start. Okay, so we can start from here, but I am really not sure. Yeah, okay. As soon as he finishes first, you can just click the side button.
Okay.
This one and this one.
Okay, thank you.
No worries. Thank you.
Thank you.
Sorry for the inconvenience. Okay, I would like to tell you something about PBSP, Subordinate System Psychomotor, which is a body-oriented psychotherapy, which is made to heal developmental and transgenerational trauma by creating new memories on an experiential level. And I would like to stress, and this is this slide, that of course then we are working in the upper part of the pyramid. So it's not about prevention, of empowerment, of coping in the community, in the family, but it's about specialized support and psychotherapy. This method of psychotherapy, can I have the next slide, please?
Yes.
And yes, can you go on, please?
Just a moment. Just a moment.
Yes, go on further, please.
Where's
Next one. Yes. Here we see the picture of the founders of this form of therapy, Albert and Diane Pesso, who were born in the same year both and also died in the same year. And they were from origin, they were ballet dancers and also dance teachers. And in their work with dancers, when they tried to learn their pupils to dance, they experienced that the dancers got stuck in their movements. And what they then discovered is that they could help their dancers to get on the move again by providing them with the right interactions. And that made them think that they better could go on with developing a form of body-oriented therapy than proceeding with training the dancers. So they developed a therapy which we now know as Pesso-Boyden system psychomotor. Can I have the next slide, please? And this therapy is based on a very humanistic way of looking at the world and problems in the world. So this is a quote by Albert Pesso saying, "We are made to be happy, be able to be happy in an imperfect world." And we nowadays know how imperfect our world is. That is endlessly unfolding, and we human beings are the local agents of that cosmological unfolding. Next slide, please. And in being in this world, we all consist of a genetic push to survive. It's about survival of the self, but also about survival of the species, in which there is an urge to make things whole. So the Pessos stipulated that this is in us. And this push is in us. And at the same time, our present consciousness is a tapestry woven of threads of memory. So we consist of our memory, and the goal of the therapy is to make a new long-term memory out of a short-term event. And may I have the next slide, please? We are all made of this information, and the information, our system is full with information. There is the genetic evolutionary storage of everything that lived before as a kind of treasure house. But of course, we all also have our autobiographical history, and we are all also we can be loaded with stories of injustice that we met during our lives. So all this information is there. And as you all know, may I have the next slide, please? It was Bessel van der Kolk in this beautiful book, The Body Keeps the Score, from 2014, who stressed that we process spatial relations with the right hemisphere of the brain. And neuroimaging research has shown that the imprint of trauma is principally on the right hemisphere as well. So caring, disapproval, and indifference are all primarily conveyed by facial expression, tone of voice, and physical movements. And according to recent research, up to 90% of human communication occurs in the non-verbal right hemisphere realm. And this is where Pesso's work seems primarily to be directed. So physically re-experiencing the past in the present and then reworking it in a safe and supportive container can be powerful enough to create new supplemental memories. Simulated experiences of growing up in an attuned, affectionate setting where you are protected from harm. And there were other theorists, may I have the next slide, please, like Ecker et al., who spoke about the same way of experiencing a new events, and they call it using memory reconsolidation. And they describe the 3 steps you have to make. You first have to reactivate, re-trigger the target knowledge by presenting salient cues or context from the original learning, and then with reactivation occurring, create an experience that is significantly at variance with the target learning model and expectations of how the world functions. This step unlocks synapses and renders memory circuits labile. It is susceptible to being updated by new learning. And then we can erase or revise via new learning. During a window of about 5 hours before synapses have relocked, create a new learning experience that contradicts or supplements the labile target knowledge. So this is about creating new memories, and the way the Pesos did it, and can I have the next slide, please? And this is the work which they experienced when they were training these dancers. So they realized that there is a sequence you have to follow. The bodily energy comes into action, but needs a proper interaction to find meaning. And next slide, please. When we put it in questions, the questions are, the energy is about what do you feel in your body? And the action part is about what does it want to do or what does it want to be? And the next step is the step towards the interaction. With whom does it want to do or be? And that is a process that we in PBSP called accommodation. It is about presenting a shape which exactly needs the right counter shape. There is a bodily shape that exactly needs the right bodily counter shape as an interactive interface. And when you do this in the right way, it automatically gets a meaning. And the meaning pops up. So when the interactive interface is right, the psychological meaning comes. And I now would like to suggest that we do a little exercise now to experience this sequence. I don't know how many people are in the room, but I saw at least a few people sitting in the room. And I would like to ask you to make a connection with the person who is sitting on your right side and do it. So can you make do it? Is that possible? I cannot see you, but I hope that's possible.
Yes, people. Yes, people. Yes,
okay, thank you. Yes, I can see you now. Okay.
We would like to be an example.
Okay, please, I would like to invite everybody to join this and to also find somebody else to do this exercise with. And for the people at home behind the screen, I suggest that you can do it maybe with somebody in your neighborhood, or otherwise, I would suggest that you try to do it imaginary. There is also a way you can try to do this imaginary. So the first step I would like to ask you now with your partner is to, as we all know how to do that, to shake each other's hands. Give each other a hand, please. Like, yes. Okay. Yeah. Like you are used to do when you shake hands. Okay. Okay. Now I would like you to do the second step, and I would like to ask you, shake the hand again, but take a little bit more time and try to really feel in your hand what's happening, how this experience gets to you. So try to feel in your hand what is happening while you are shaking each other's hands. Yeah? Okay. And now try to share that for a short moment with each other. What did you experience? And maybe Alina and partner, could you share with us what you experienced?
Yeah, you can start. Okay, so Alina is my good friend. So I just felt a handshake from a friend. Sorry if you can hear me. Just a handshake from a good friend.
Yeah.
Uh,
What did you experience?
Experience. That's a very difficult question. But yeah, friendship.
Friendship. Okay. And Alina, what did you experience in your hand, the bodily feeling?
That's quite an interesting exercise. I would say the first time it felt quite trivial. So I wasn't very aware of what's going on.
No.
But
And the
once
second
you
time?
answer, yeah, the second time, like I felt the warmth that is coming from the connectedness to
Okay.
the first. So
Okay.
that was like a important feeling.
Okay, thank you. Thank you. So now we do the third step. Please divide. One of you is the receiver and one is you is the giver. So make a deal who is the receiver and who is the giver. You are the receiver?
I'm the receiver. And
Alina
I'm
is the receiver. Okay. So now I would like you to shake hands again, but now Alina, you try to feel and tell your body what kind of handshake you need at this very moment. So let your body try to feel what is the right contact for this moment. Do you understand what I say? So you shake hands again, but your hand is trying to feel what it really needs at this moment. And give him instructions how he should shake your hand. So you can say a little bit more, stronger or wider or.
Well, I would say that I need a little bit different position in hands. Like
Yes.
if you see like this time, it's like a very, very congruent kind of shaking hands. So in this way, I feel much stronger support. Like I know that person is very close to me.
So it now gets, no, so stay, please. Stay with the hands. Yeah. So you say now it is strong and it feels as support. Yes. So if this feels right for you now, does it feel right?
Yeah, it feels right.
Would you like him to say, I can give you support while he still holds your hand? Okay?
So Navdeep has to say.
He says, I can give you support.
I can give you support.
Okay, and you take that in.
I take your support.
Okay, 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 thank you. You can stop. And if you like, you can now change roles. So he becomes the receiver and you are the giver. So do the same thing. Okay?
If we might just ask the other two guys, maybe to be an example for us, what do you think?
Okay,
Yeah?
that's fine, but they can do it as well. So, hello, can one take the role of receiver? Yeah, and you are the giver. So the receiver say to the giver how he should make contact with your hand now. Try to feel what is right for now, okay? So give him instructions how to do it. Should you need more or stronger contact or? Is it right like this?
Yes.
Okay.
He got faster, I got faster too.
And what does it mean? How does it feel? What does it mean?
I mean, I feel secure because he's giving me instruction on how I have to do this.
He's giving you?
Instruction on how to move my hands.
Yes.
Unverbal instruction. Unverbal instruction.
Yes. So, and how did it feel? Did it feel right?
Personally, yes.
And what did it give? What did it give to you? What did it give?
A sense. It was very formal. It was okay. It was secure. Yeah. A sense
Secure.
of security.
Secure. Okay. So he can say, I can give you security.
Yes.
Yes. So do it again, and then he says, I give you security.
Okay. I can give you security.
And take it
See,
in.
this time is stronger from the start.
Okay. Okay. Thank you. Thank you.
You're welcome.
Yeah. Okay. So this is a very small example of this process of accommodation, shape and counter shape. And if the shape and the counter shape is exactly right on the shape, there comes a meaning. That's what we call the interactive interface in the process of accommodation. Can I have the next slide, please? There are 3 tiers or levels in which the interactive interface in regular life is not fitting. And the first tier is that our basic needs are not really met. And when our basic needs have not been really met, a deficit is created. Think of you came to the world, but your parents had no place for you because they were not expecting you. That means not enough comes in. There is a deficit in a basic need. There is another level when it is not fitting. That is when the boundaries of the self are breached. That means the interactive interface provides insufficient protection from trauma and too much comes in. So we are in a way penetrated or compromised. There is a third level And that is when that we are unconsciously drawn into satisfying the needs of another or seeking to heal the injustice in the world. And that means that too much goes out too soon. So these are three ways that our interactive interface is compromised: by deficits, or by trauma, or by parentification, or what we call in PBSP, we call that holes in roles. We have to fill the holes in roles of other people. And this interactive interface that is compromised is what we call the old map. And we can make new memories by using ideal figures on the right age and the right kinship level that provide an healing interactive interface for previous deficits or violations on tiers 1, 2, and 3, creating a new map next to the old one. And can I have the next slide, please? Doing this work, the Pesos came to this developmental model. And he said, what we need in life is that our 5 basic meta-rational needs are met, literal and symbolic. So that means that we all need in life to feel that we have a place in the world, literally, but also symbolically. That we are nurtured, that's another basic need, that we are supported, that we are protected, and that we were provided with safe limits. And the second developmental task is that we learned to integrate and unify the polarities in life, in the gender sense, but also the gene pool from our father and from our mother, that there is a balance between our right and our left hemisphere. That means between the rational and the more emotional part, between our sensory side and our motor side, but also in the way we put out, but and take in life. The third developmental task is about that we develop our pilot. That means that is that part of ourself that controls ourself, that is masters ourself. You could call it the CEO of the self. That our consciousness is developed. It's about learning, about meaning, about language, but also that our unique talent and potential is fulfilled. So in this therapy, we use this developmental model on working from the body to help people to become who they really are. And we do that in a therapy that we call a structure. Can I have the next slide, please? And in this structure, you see that we always start at the left upper part in the true scene, what is here in the here and now. That's in the present, but it's also, it represents the old. And when we use our techniques, in the end, we will find which historical scene is present in this client. And this historical scene is in a way representing what is problematic at the moment, what has been missing, what are the deficits, what is the trauma, and how can that be healed? And it can be healed in the past, in the symbolic past, in what we call the antidote. That is the new memory, which is created by presenting ideal figures, ideal parents or other ideal figures that on a bodily experiential level present the client with what was really has been needed. And when this is established, there comes a new perspective for the here and now in the client. And this process, this therapy, what we call a structure, is very much under the guidance of this third developmental task. It is provided by the pilot of the client. So the client is very much in charge of this whole process. The pilot is doing this. And in red, you see all the techniques that we use in this therapy. It's too far, I think, now to tell in detail about all these tools that we use. We create a possibility sphere. We very closely micro-track the client in what is happening, and we put the inner drama of the client in the room. We do this by using all kinds of objects or persons that represent the old historical scene, and then we reverse that in what should have been there necessarily. So, for instance, if in the historical scene a father pops up who was very violent and abusive, then there comes the figure of an ideal father who would have presented safety, provided safety and caring. And if the client is able to take that in on the right age level and on the right, from the right kinship figure, in this case an ideal parent, it helps to internalize that and to get a new perspective in the therapy. So this is, in short, the process of the therapy that I would like to present. And if you want to know more about this kind of therapy, and next slide, please. I can. You can go to the website pbsp.com, and also this book is a very good summary of the work. There are many books about PBSP, but the book by Winnet and Balin is a good summary of this kind of therapy. Thank you for your attention.
Thank you so much. Thank you so much for this short but very deep presentations of theory, practice, and practice by other persons. I met other persons many times, and his teaching is very, very important in my practice still now. And his friendship is very important in my heart. So thank you so much. Now the next presentation is what?
Yeah, we would like to ask one question regarding childhood trauma.
Good, there is a question.
Maybe could I ask the same question? Maybe he will help us.
But you ask him because he doesn't listen. He doesn't hear.
Yeah, because he made the practice. Thank you so much.
Arnold, you are still there, Arnold. Arnold, you are still there. Yeah, okay.
Yes.
Thank you so much for this interesting topic and interesting information. We also appreciate listening. And we just want to ask you some suggestion, your opinion in our situation, our problem. I represent Swiss Association from Ukrainian women, and we support children from children. And now we think about project to help children.
Get him a bit louder. He doesn't hear you well.
Yeah. And now we think about project to help children on their situation. And first we find a camp which supported children and helped them with mental health. But it's just few children which we can help. Now we want to increase amount of children, and now think about projects. Which project you recommend? About creativity, about mental health. For example, if we organize some psychology centers with supporting, or maybe we can pay some creative circles, creative activities for them, or some sport section. Which method will be the best for the children to increase their maybe mental health and self-esteem, empowerment, and empowerment of their situation?
Yeah.
Thank you.
We do, I think in general, this method helps a lot to understand about what children are really needing, especially using these basic needs on a physical level, just as a model. In the therapy, the model for children is very different from adults, because with adults you speak about ideal parents as parents that are supplying the things that the real parents could not supply. With children, of course, they're still very much connected to their real parents. So in Germany, a colleague of mine, Michael Bach, has developed a method in which the real parents, in a way, are in the room with the children, and the real parents are helped to supply what an ideal parent should supply, if you know what I mean. Is this an answer to your question?
Could I ask you, as I understand well, you recommend to organize special groups, which adults, which help their children to imitate their real family, and they're together?
Sorry, I
Is
didn't.
it true? Could I ask you, as I understand well, you recommend to organize special groups, which real parents, adults will help children? Just to try to speak, to communicate with them.
Yes.
Is it correct?
Yes. So you start with working with the child in the presence of the parent. It's not in a group, but that's the child with the real parents. And then you help the child to make clear what it has been missing. And you help the real parent to become, so to speak, an ideal parent.
But they don't have parents.
Did you get it, or?
Sorry, I just told that they don't have parents. We can find some adults and they will imitate their parents. Is it true, or I didn't understand something?
Maybe I did not understood your question very well.
Listen, the situation is the consequence of war, and so people here have children without parents, and
Yes.
they're trying
Yes. Okay.
to have children who missed their parents.
Yes.
So that's a different situation. Maybe we can
Yes.
talk about that with more time, because I know his techniques, and so I could we could find some way to create a methodology which fits their needs, and you use the Vesodoiden techniques.
Piera and Alfred, I just want to ask you last question. For example, it's our initiative, not children come to us and said, okay, I need to help. And if we speak about therapy, if work method, then, for example, we decided, okay, we want to help, I don't know, 10 children, and we organize 5 months of physical support. If this method will work as not you think about help, just I decided you need this help, maybe they will close their mind on that case and will not open for psychologists, for the specialist when children don't want this help. Or you have some method how to open their hearts and help them for 5 months, I don't know, 3 months, I don't know how many months they need to receive this support and to receive powerful inside their head and inside their hearts.
Well, you mean children who are in Ukraine or who are here?
It doesn't matter. It's just children who have
trauma. If we can work with them directly, it's different from working indirectly if they are far from here.
No, I think it must be on present, not online, because they're children and they're small. Yes, here.
Okay, so we can do.
Or we can collaborate with some psychologists. We can teach them or learn, or I don't know how it's work, but I want to find a solution of this situation.
Yeah, yes. I think that we can work on that, and we can have meetings about that, and maybe Arno can help us with his ideas and experience.
If it will be work, if children close their hearts and don't want to increase their power, because they didn't come to us and tell us we need to help. They don't understand it, and they don't ask about help. And when we start to think for them,
listen, we have to work with adults that are around them, that are in relation with them, because even if they haven't their own parents, they for sure they have adults who try to replace their parents, to try to do something for them, who instead of their parents, and as if they were their parents, and so we have to work with the adults who are around them.
It will be first step, and
yes, that's the first step.
Yeah, thank you so much for your answer.
Thank you.
Thank you, Arnold.
What do you think, Arnold? Arnold, are you in line? I will touch Arnold. Maybe he isn't.
He's not able to hear us.
He's not online now.
No, he's online, but she asked some question and
Okay. So thank you for everybody, and for this very interesting interaction. And now we have our last presentation, and it is by Inna Gavilyuk. She is a clinician also. She had a master's in psychology. She's a psychotherapist and qualified in law dynamic, analyst and supervisor. She was trained as a Gestalt therapist also and a psychodramatist. She is teaching all levels of body dynamic training in many countries around the world, Ukraine, Poland, Germany, Portugal, and Brazil. And she also is member of the Ukrainian Union of Psychotherapists. Her speech is about how our body keeps us score and what we can do about it in therapy. How can
Okay, she can start speaking.
Okay, can you hear me?
Yes, we can hear you.
And we have the slides.
You can share the slides. Okay, it's a share button on the top right.
We can't see her.
Press escalate with the keyboard. Okay, okay, could you share the slides?
Me? I do not have slides, so
Okay.
I'm going to share 2 pictures if it will be possible, but I'm going to talk and no slides.
Okay, no worries. Okay, you can share the pictures using the same share button on the top. Okay,
Okay.
So can I start?
Yes, sure.
Okay. So my name is Inna Gavrilyuk. I'm from Kiev, Ukraine, and for already I'm now counting 14 years. I am in biodynamic approach. So I will tell a couple of words about it. Biodynamic is a modern modality of body-oriented psychotherapy created in Denmark in 80s of the last century. Biodynamic is a unique approach, not only by methodology, but it's one of very, very few psychotherapeutic approaches who was created by a woman. And it does something to the system. So since it is body-oriented approach and it is my speech is the last speech and you all are tired, I would invite you to stand up, please, and to sense your body. I will also stand up and it will be very, very, very simple. First of all, sense your body. Now, in the evening, almost 9 o'clock. It was working day, it was working week. Tomorrow is weekend. So sense your body, sense your feet, sense the weight of your body. And now start walking movement, like just step on the floor and sense how your body vibrates. And try to sense this vibration till the top of your head. And now stop and sense your body again. Just register a little tiny changes in your sensations. How is the contact with your feet. What do you sense in your body? Good. And now please press your hands in front of you. Just press with all power your palms together and hold it for a couple of seconds. Hold it. Hold it. Hold it and breathe. And slowly let go. And now grab your hands and arms like this. And now pull to the sides. And if in previous exercises, frontal part of your body was tense, now your back should be tense. And hold it and breathe and let go. And sense your body now. Like, I feel now more presence. I feel a wave of energy in the upper part of my body. I feel like I did a little exercising, I did a little workout. So I will go back, sit and continue. So these small, tiny body exercises can do a lot to the way how we feel now. Hello, can you hear me?
Yes, yes.
Okay. What biodynamic can do? Why? Which instruments biodynamic can bring? This system, as I said, body-oriented system, is created based on psychological functions of our body, psychological development of a healthy child, together with motoric development, so that both psychological developmental process and motoric development, they are connected, interweaved, and the way how the child went through psychological development affects the body, and opposite. The way how motoric development was happening with the baby affect psychology. So this is a way, and knowing that, we can really work with developmental traumas, with early childhood traumas. So powerful parts is like we from one hand can work with psychology, and we can work and include the body. I would like to talk a little bit about trauma and how we work in biodynamic with trauma, because that's what now makes a lot of sense for my country and actually for the whole world. So I already mentioned developmental trauma. And this is what happens during development of the child. There is also shock trauma, which can happen anytime in the life and which has difference from developmental trauma. There is a very clear definition of the shock trauma and also PTSD in DSM-5, in ICD. I will just mention that as an opposite to developmental issues, shock issues have just like urgent and very rough influence, which has start and end, or which can be repeated. So the important thing is that in every traumatic experience, body participates. And here it's a nice time to mention the most important principles of biodynamic, which are dignity from one hand and mutual connection from the other hand. The child from the birth is born into mutual connection. The child, even conception is when the child just start developing, is we need 2 cells, an egg and a sperm. And the child is never unity. The child is community. The human being is community. The human being is born into family, into connection. It's one part. And the other part is our dignity. It's what makes us unique. It's what makes us very, it's connected to our vertical line, and it's what makes us humans. Our dignity and mutual connections are always affected during traumatic experience. And if we speak about developmental issues, biodynamic says that either dignity or mutual connection could be affected, meaning that a little tiny child will choose to preserve mutual connection and let go of dignity. And it's just an example, it's not the rule. But teenager, for example, will say to parents, no, I hate you, and smash the door. And that on a symbolical level means that this teenager preserves dignity and abandons, pushes away mutual connection. So when shock trauma happens, both dignity and mutual connection are affected. Actually, we cannot keep one and be without the other. It's always balance. It's always like tango. And where do we preserve information about trauma events? Of course, in our memory, in our emotional memory, and in our body. Again, in biodynamic, we have a unique instrument called body map, where we can test muscle responses of the body. And it's like 125 muscles on the body tested. And we can see, according to the muscle response, if some psychological functions, psychological aspects for the person are resourceful or not so resourceful, or even encoded, have a traumatic coding. What it can give to the psychotherapist. Of course, we know better where resources are, how to work with the body so that we could support the person in resources, and where we need to avoid to go so that we wouldn't provoke unnecessary feelings, unnecessary traumatic experiences, flashbacks, and so on. So it's quite precise, interesting instrument. Of course, this 20-25 minutes would not allow me to talk a lot about it, but I will just give an overview so that those people who are interested could later search for that. So next thing I would like to mention is like what we do with trauma, what we do with PTSD. Of course, there is a way to work, somatic work with the core of shock. The interesting thing is that based on our experience, quite often, and it's an experience in Ukraine, not only in working with normal, I'm saying normal, but with civilians. People trained in biodynamic approach work starting from 2015, in an organization which first called Wounded Warrior of Ukraine, now it is Veteran Hub, very well-known organization. So they work with veterans. And what did we discover? We discovered that it's not necessary to work with the core of shock and to go into shock experience, to unwrap all that with every traumatized person, with every person which has PTSD. And now it is very popular to talk about post-traumatic growth. Post-traumatic growth is based on the work with resources. If we work with and re-establish access to resources of the person, if we re-establish ability to keep, preserve dignity and reconnect, be in mutual connection with other people, then client often claims that his trauma doesn't bother him anymore. So this part of work is now extremely important in Ukraine, because we